A special good morning to you, our viewers in St. Lucia, as well as St. Lucians in the diaspora watching this morning, NTN Live, for the latest updates. This is another installment of the St. Lucia COVID-19 Response Report. My name is Jessie Leonce, and I'm joined in studio, as usual, by my colleague, Carlton Cyril. Carlton.
Bonjour avec merci Jessie, bonjour à mademoiselle Grandison. Quand la coutume, c'est toujours un plaisir pour dire bienvenue. Merci nous en headquarters COVID-19, qu'about développement, qu'about information qu'on y a fait. Aujourd'hui c'est jeudi le 21 mai, nous allons continuer à ce même chemin. Pour nous qui est sur Facebook, qui suivent nous sur social media, nous allons dire bonjour, merci tellement pour ces gens dans l'autre pays. Pour vous écouter nous avec tant de voix nous sur radio, bonjour à sur un jeudi bon matin. Nous allons continuer comme on dit about information développement qu'on y pour faire les affaires COVID-19.
Now, St. Lucia is on schedule for sweeping changes. That is the resumption of our society, our very existence, our normal operations here in St. Lucia, but a new normal. As St. Lucia reopens, we have to take into consideration COVID-19, the ever-present threat in this day and age, and the measures that we need to take, to continue to take as we go on living our lives to protect ourselves from contracting this deadly virus. Once again in studio, we had her last week, and she was so good. We brought her back in, Miss Naomie Grandison. She is the Family Life Educator at the Bureau of Health. We'd like to welcome you. Good morning. A special good morning to you.
Good morning, Jessie. Good morning, Carlton.
Good morning. Good morning.
Thanks for having me back. You know, I'm feeling like I'm part of the family already.
Yeah.
That's the plan.
Yeah, oh boy.
We have individuals returning to work from this week. Businesses are reopening, and next week we will see, well, into the next fortnight, we will see the full reopening of our society with the resumption of tourism accommodation services. Our borders will be reopened. Things will be back to normal. But if I can quote Dr. Faswa from yesterday, not too abnormal, because we have to get used to the new normal, which is the wearing of masks, the observance of the 6-foot distance, and so on. When you think of it, you know, for face value, you think, oh my gosh, this is going to be a cesspool. COVID-19 will be everywhere. And, you know, some persons are proceeding with trepidation. What is going to happen? You know, the risk will be greater. Can you just speak to, you know, the importance and the significance of us taking careful consideration of the measures, even more so now as we begin to reopen our economy and try to come back from this period of lockdown from COVID-19?
I'm really happy to hear that persons are a bit anxious about the movement of persons increasing. To a certain extent, that anxiety can help persons to become more interested in what they can do and how they can encourage others to remain vigilant. I want to first say that it is important for us to have some faith in ourselves that we can make the changes, and to develop the courage, furthermore, to encourage others to do what it is we've been saying to do. Habits is what we need. We need good habits. We learn that we need to bathe every day, brush our teeth. You understand what I'm saying?
It's the basics.
It's basic stuff. And if anybody has been listening, even the persons who are on the streets who do not have a place to live, you interview them and they give you the basic information about the prevention of COVID-19 because the information is out there. So right now, good. I really want you to be a bit anxious, concerned, because we are opening ourselves up more, the movement of people coming together more. So it is even more important for us to be vigilant and to be self-aware and to know the information and practice it. So I want to do something this morning, like a little self-awareness exercise.
Sure.
You know, I just want Carlton and Jessie to humor me for a moment. And right now, just pay attention to your body and think about where your hands are right now. Yeah, so you're aware of where your hands are? Carlton, I see.
I am.
Freeze me.
Yes, yes, you don't have to freeze, you don't have to freeze.
Okay.
Right, so as you are sitting here, remain conscious of where your hands are. Remain conscious of where your feet are. Yes. Just in yourself, be consciously aware of where these parts of your body are, how your foot is touching the floor, if it is touching the floor, how your body is connecting to the chair. You know, just allow yourself to feel yourself connected to that chair. What does that feel like? Drop your shoulders to determine if they would a bit tense. Yes. So drop your shoulders.
Well, I had to buff up mine.
He had to buff his up. Oh my God! You see the difference between the male and the females, eh? He had to buff it up. We're cool if we're bringing it down. So I do this. It's a small exercise of just self-awareness, so that if you are sitting on a bus, if you're at a meeting, if you're in the office, do a check-in. Where are my hands? How am I sitting? Where are my feet? You know, all these things help us to have more control over what action we're going to take. Vigilance is key because a decrease in the adherence of the protocol to prevent COVID-19 is going to put us at greater risk, because what we were doing before has contributed to the control of the COVID-19 in St. Lucia. So if right now we think, oh my God, the place is open, we're safe, we don't have any active cases right now, let me go back to the normal, which is what I'm seeing. Some people are literally, you know, it's like back to pre-COVID. If you begin to act that way, you are going to take away the environment and the actions that was preventing the COVID-19.
In the first place.
So if we want to continue to keep it low, vigilance is important. I want to thank all the businesses and the persons who have been taking steps, and Lucia has done a fantastic job. The situation can change quickly. We can go from 0 to many in no time. And the main thing that we have to do is to continue to practice these things, and we'll get into that. There could be possible unrecorded cases. These are all the reasons we need to remain vigilant. Yes, we have 0 according to what we know. What about those people, as doctor said yesterday, persons coming back door?
Yeah.
What about those persons who hate doctors and nurses, and who would be coughing, feverish, feeling weak?
Just drinking a bush tea.
And then, you know, drinking the bush tea, going and bathing in the sea, well, I don't know, some of them will bathe in the sea even if we said not to. So persons, generally, a lot of persons don't come in to get the assistance. So these people could have the virus even if they're not diagnosed, and they can carry it on to others without being aware. You understand what I'm saying? So we need to remain vigilant, and we need to remain, not because, let's say, you learned how to brush your teeth as a child and you didn't get a dental carie, or you understand a decay in your tooth, that you should all of a sudden stop brushing your teeth. So we need to continue to practice those methods that will keep COVID-19 at bay.
Definitely, the government of St. Lucia has put in place several measures to ensure that, was very stringent measures. If you go through the protocols, by the way, if you're just joining us, a special good morning to you. Businesses are reopening. St. Lucia is on schedule for full reopening come the first week of June 2020. And we do hope that you are preparing for that. And part of preparing for that is the going onto our website, the COVID-19response.lc website, and looking at the protocols that are relevant to your sector, to ensure that as you open your business, that you are opening in adherence to the protocols as outlined by the Ministry of Health and Wellness. So that website, just do a quick plug-in to make sure persons understand. The government of St. Lucia has put in place several stringent measures to ensure that we are safe at this time, to protect St. Lucia as much as possible from this COVID-19 threat as we bring persons in. And beginning with the very first thing, when you have visitors coming to the country, they paying their ticket to come here and so on, it begins with having a COVID-19 negative test. So we just want to assure the general public that there are very stringent measures that are put in place to ensure that we have as a low a risk of getting COVID-19 in St. Lucia. I want to continue by asking, just if we could go into the proper use of some of the measures that have been put in place. They've been telling us to wear our masks. And I remember a couple of weeks ago, Cooks was talking about the proper way to wear a mask.
Okay.
You know, if you could just speak to that a little bit. The 6 foot distance is cut and dry.
Yeah.
You know, but
in
the
a
mask.
sense, in a sense, some people cannot estimate it though. Some people without the lines, they cannot estimate the 6 foot distance. Moi, really voulais ça Carlton te dit about masks là avant moi commencer. Avec de nous ça discuter.
Oui. Moi quand nous changer gain les Jessie avec nous dans créole parce que Oui. Parce que quand Jessie bien dit, quand nous a dit bonjour cette lycée, sous ka chile ça calé, ou qui ka suivre programme nous ici, quand ça nous tenir Grandison ici et puis nous, ici yon qui ka indiqué Monica hay bureau santé ici moun ka instruit mon sous matière famille et ko kay ça venir à présent chaque monde besoin direction avec Gide ça c'est yon c'est responsable là ni pour instruire moun bay moun information et qui puis nous semaine passée qui Javier avec nous content ça tellement quoi parmi bagay japa là c'est là vini pour nous qu'on yon pays qui a préparé comme nous expressement qu'on pays a vie ouvert. Nous ka dit c'est un bon baran compagnie moun te kay ni perwez i ka dit en compagnie moun te kay dit moi ma ka sort dehors moi ma vle joindre vermine ça pe pour sort dehors mais i ka dit c'est un bon signe là ouais moun ha paré pour sort dehors moun ha vie paré pour engager yon a l'autre société en commune mais en même voix nous ka parler les vini pour précaution, c'est protocole national qui j'ai établi. Et quand sous question de masse, vous êtes bien content pour dire. Et là nous tenons discussion ici, ça nous déga dire c'est un pile monde ni masse là qui quoi comme si dit c'est un toys et ben bébel. Yo ni a ba maton yo, ou ka ouais moun ni enfant yo, et moi déga dire c'est ça. Et juste hier moi qui parlait de ça, là il vini pour parler dit là au patient c'est comme maintenant, ou ka ouais personne pas pressé pour mes masses, mais depuis ouais yo vinn en ville parce que yo savent yo passant trop ces places business là tout le monde en masse mais comme si de là il va en commune vers maintenant pas en commune ou passe à Simon ou j'ai ben joindre ni contacter là en commune parce que fijay moi pas ni ça pas ni mais ça nous regarder about masse là c'est là on est masse là ou supposé qu'à ménager masse là et mettez un néon pour ba ni néon avec bouchou et changer c'est petit code dans aller des oreilles au niveau mais et puis doit tout et ou quand empêcher quoi chaque on te dit parce que c'est manière féminine quand entrer en bouche pas néon pas bouchou il peut entrer sous main en bagaille et si on y en masse et c'est ça qu'on empêcher faire pour qui ça chaque lait qu'on on y même la main ça ka même masse là ou ka prendre même la main ça au vent bagaille patcher bagaille pour manger fouiller même la main ça quoi on y ka fouiller bagaille dans bouche plus vite quoi nous te ka dit moun supposé changer masse là pour empêcher vermine simmerger quoi nous ni pour prendre précaution qu'on là on est masse là sous trouver quoi il ja presse mouillé pour changer là on est masse là c'est masse expressement c'est ça yo ka servi pour l'opération c'est yon bagay ka servi yon des fois dépendant à sous kotoye si c'est un monde qui hani c'est yon fois aussi poser ni masse là quoi conseil là c'était monde ka prend qu'on blague en compagnie monde qu'on fashion et que pas comprendre ça là pour protecteur et ou pas supposer en de ou na masse mais changer ou kan empêcher vermine pas encourager vermine entre mais à sous ligne ça nous de discuter.
Ah oui, ça va. It's important for people to recognize it's not what you do, it's how you do it. So you wear a mask and sometimes you feel a false sense of security. Uka kachile, uka kwe, then more alright, pismen ni a mask as suffisant. But is what you do, and as Carlton said, this is a surface, a piece of cloth that is over your nose and your mouth where you are breathing small droplets and particles, so it can become moist. And germs, bacteria, love to rest on moist places. It loves enclosed areas. That's why when we're at home and we have that level of darkness, if you close up something and it's moist, then you can get more germs accumulating. So because of that, that is why we're telling persons do not touch your mask, the top surface of your mask, because this is what is exposed to persons speaking, talking, the particles that you pass around. Okay, we're telling persons to, as Carlton said, to hold the cord towards the back, to put and remove it, to wash your hands or sanitize your hands before and after you take off your mask. And most importantly, if you touch your mask by accident or because of a need during the day and you touched the front of the mask, you need to immediately sanitize your hands in that moment. I am very concerned when I see persons continually removing their mask and I don't see a sense of urgency to sanitize right away. This is a surface that is a barrier that is exposed to people speaking, to the air that you pass by, to the very particles that are settling from inside. It is something that you do not want to be touching, because that hand you can put by your eyes, your nose, or your mouth, and you can touch surfaces with. So you want to reduce the possibility of the vermin simosje. So we need to be mindful. The next thing I want to bring up with regards to the mask, interestingly, at the one of the wellness centers, well, not one, I'm just saying generally, we have people who genuinely don't know that they should wash their mask daily. Or at least as you wear it, you've gone out for the day, you've worn it.
The reusable ones.
Yeah, the reusable ones. Thank you for that.
Cloth.
So the cloth mask, if it's a surgical mask, of course, you'll have to dispose of it. The cloth mask that we've been seeing, we have to consider that like, I hope I can say this, like an underwear, really. You wash it. You wouldn't go back and put your knickers back on. You wouldn't do that. So please be mindful that when you get home, you could quickly wash your mask the same way you would wash your clothes, your panties, and so on, and put it to dry in the sun, or you could put it in your washing machine. Do not reuse your mask if you've been out in the public, going to different businesses, going to different, during the day, yes, you have that mask. Sometimes you may need to take it off and put it back on, on and off. That is fine, as long as you remember how to handle it in the interim. I have here what my method has been. I have this like a Ziploc bag.
Make it look bad.
Jesse, we're covering you. Jesse's own. The camera can't reach Jesse right now. So this is how I do. I have my my Ziploc bag, and when I remove the mask, I place it into the Ziploc bag, and I think when I have to, because you're in your car, people feel uncomfortable with the mask, and I want us to go into that afterward. What are the barriers? So, just to free up yourself in between when you're alone or you're not going to be around too many people, when you could be away from people, you can remove it.
When you're not in the public.
When you're not in the public, right. So you can remove it and then you could put it back on. But please have a bag or something that you can seal, and so that you're not throwing your mask here, throwing your mask there, throwing your mask, because it is a contaminated surface. Keep in mind that it is a contaminated surface.
Just one little observation. When it relates to persons saying that wearing your masks, everybody these days comes up with a fury. Wearing a mask now is you're breathing in more carbon dioxide and oxygen and whatnot. Speak a little to that aspect.
Moi apprécie ou parler about ça, Carlton. Puis, il est important pour nous address pour qui raison un monde pas vle faire bagay. Délai c'est bilifio. Kachilio. Ek comme pas ça dire moun pas believe a faith Catholic or pas believe a faith Seventh-day Adventist. Tout moun need different belief.
La
foi yo. So I dare to say that a number of us have different points of views. Some may call them conspiracies. I would simply refer to them as theories. What I would like to say though, and I want to speak directly to those persons who may not even openly tell others that they believe a lot of those things that would make them not want to abide by the mask suggestion, or make them be averse to the social distancing. A lot of persons have been very hurt and wounded, I would say, by past occurrences with persons who are professionals, with organizations, and we have to admit that it is the truth.
Right.
We have had experiments being done that were unethical in the past. I'm not speaking about us in St. Lucia.
Right.
And so you find there is a pain that still lingers, and there is a distrust in a lot of persons, and we need to address that. This distrust is almost like when you are in a relationship. So let's say I was with Carlton, and Carlton betrayed me. Okay, so one of the organizations, like there were tests being done on certain populations before, and we know that it was unethical, and it came to the fore. And then I move on to another person. Let's say I started to date Miguel or somebody else, and I respond to Miguel as if it were Carlton.
Still carrying it.
Because I'm carrying it, because
Trauma.
the trauma, the news of how these professional or these medical people or whatever have done things that were harmful to me and my people, I still carry it. And even if it doesn't even match, the organization is different. The information and the validation of the information is clear and proven. I still filter that information with distrust. So I want to tell persons out there to open your mind and really see if you are carrying a situation which is not the same to this situation. We have the entire world of professionals in every single country who are doing their own research. Are you telling me that these professionals are all coming together to propagate something that is untrue? It doesn't make any logical sense. So I want persons to really look at it from a broad sense and don't carry that pain into what we are giving you today. Some of those things that people believe, I mean, let's just let it be and see how things unfold. We cannot always, people will always speculate. People will come up with their own reasons. That's what humans do. But the WHO has a team, World Health Organization has a team of people, professionals who critique other research to determine what they can say is certain. And what is proposed, they will tell you it is proposed, it is not yet confirmed. Of course, people can decide to try what is proposed. So I just want to encourage persons to challenge that thought system. The carbon dioxide, the stifling feeling, it is understandable. A number of people have felt it. Hence the reason why I decided to bring to the fore the fact that when persons are away from a crowd or to go into a business and stuff like that, and they're alone or at a distance, they can remove their mask. And if somebody has a respiratory issue and they find it difficult to breathe, allow somebody else to go out, or ensure that they choose the right mask. Ensure that the mask it's snuggly and whatever, but the material is breathable enough.
It's not constricting.
Yeah, and it's not constricting. Ensure that whatever they go out to do, they do it quickly, purposefully, so that when they do get back into their homes or their space where there is limited contact, they can remove the mask adequately. So also I would like to say too, we can bear discomfort more than we think we can. If it is for our own good, it is better to bear the discomfort for that little while, monitor how you're responding to it, than to put yourself at risk for something that can devastate your entire family.
And of course, Jesse, just to add that part, remember speaking to Commissioner Daisy. He was saying when our state of emergency was enacted, part of it relates to the wearing of masks. Those under the Constitution gives the policemen the power. It is legislation right now.
It's mandatory.
It's mandatory that you put it, and it's not just for style. But like you're saying, you could use your discretion, because I've seen persons alone driving and they have the mask, and I say, man, I have this mask. You're alone in your vehicle. You're the sole occupant of your vehicle. It is okay. Remember again, what we are saying is the mask is to prevent the spread, and of course, mainly in public when you come to public, which is why it brings us back to staying at home. If you're at home, there's no need to wear a mask, you are among family and whatnot, so They go hand in hand.
But we're coming into a place where now business work is resuming, and
Right.
we need to adhere to those. You know, the Prime Minister, the Office of the Prime Minister put up a statement, 6 feet distance or 6 feet under. You know, you
like
choose
that.
which you want, you know, and sometimes, you know, we have to make sacrifices, as you mentioned, Naomi. We have to make sacrifices for the greater good. The population is at risk at this time. So,
So we say those things, but people don't think it's serious. You say when you say you're going to go under, they don't see anybody going under. So it's like, oh, we're good. You know, these people are exaggerating. We don't have any deaths
serious cases.
Oh, I am not sick. My family is not sick. That's why on the community level there is more of a relaxed kind of response. What I do want to say is that we need to learn how to critically think. And what we need to remember is that social gatherings, close contact with persons, hanging out on the steps on the block outside, coming together to play dominoes, crowding up in a small store, and all these things. These are the situations where it is easier for any type of respiratory agents to infect persons. So if you are going to make a decision about when and how, keep that in mind. When you're going into a business where how many hundreds of people are going to be passing through a day, you need to be mindful. So we need to people need to think about how and when they are going to do what they're going to do. And if you are out, how close you're going to be to somebody. If you are in the workplace, there are persons who would be at a 6 feet distance. There's limited movement. You're not serving the public. How are you going to manage? Are you going to keep a mask on for the whole day? Is it practical? You understand? If you have your own office and you all are spaced apart. So we just need people to critically think about what they're doing and to do it consciously.
Moi just voulais répéter ça ou dire il y en a ces bail là moi quoi qui bien important nous t'en hot mademoiselle Grandison c'est là vini pour monde qui observer qui dit personne pour mort mi garçon ouais sans les filles moi hot top couillon hot just ka fait moun paix ek pewez lan moun supposé ni moi qu'on a bien dire c'est parce que nous pas jamais ouais personne mort et ben nous pas une pièce pas pour dire un moun allant les yon ces machines respiration et ouais moun ça ka mort qu'on nous avons les télévisions so comme si dit ouais ma connaît personne qui jamais ma même connaît personne qui ni et quand Jessica dit nous ni ça garçon Charles qui a tué ça et toutes ces bagailles ça et moi quoi il bien important pour moun comprendre ça c'est côté nous sortir qu'on nous calé quand Jessica a bien dit tout à l'heure là à présent nous ka ouais tout le monde ka dit qui joue ka ouvert pays qui joue ka ouvert pays a ouvert à présent mais tout business ouvert et c'est pour ça bagaille te mettre en place avec les une consultation y en a ces bagailles là yo dit c'est en ouvert côté nous sortir yo met pays à clé la clé tout partout dit moun passe à sorte d'or nous sortir de ça et yo bail information c'est pour raison nous ici à présent qu'a dit moun qui ça supposé faire qui savait minnaye qui ça il ça fait avec manière pour empêcher wete caillou sou pas besoin sorte d'or parler et quand parmi baga ou attendre côté moun ka fréquenter c'est côté ou ka ouais vers mine si ni pour exposer comme ça là où ça joindre masse là soit quand moun ni pour comprendre pas dit temps ou pas ka ouais personne mort et ben moi dit nous pour ni personne qui mort grâce à Dieu merci ça pour qu'on fait mais nous ka dit moun toute bagaille ni importance li et pas point pour dire ouais mais c'est moun ça jusqu'à dit ça garçon ouais ça comment do pour gain un bray et jeune monsieur a dit moi cox hot just la ka fait moun paix y a pas ka veut ouais garçon ouais moi ça moun qui ni pièce vermine ouais moi ni covid et c'est ça
Listen, I'm happy you brought this up and before I move into my point I just want to remind persons that the mask by themselves are not effective alone in preventing the spread of COVID-19. We've been saying from the interim, as everybody should know, one of the most important things to prevent the spread of respiratory illnesses generally is to wash your hands. And the mask sometimes can give a false sense of security if we do not do it properly. And if the other person is not wearing it, that's why the shop owners need to enforce it too, even in the small communities. If I wear a mask, I protect you, especially if it's a cloth mask. If you wear a mask, you protect me. This is because there would still be a few little spaces sometimes. You really want to avoid it as much as possible. But if the person does speak and spit and cough and whatever, it may be able to enter. So if they wear their mask, it can be contained. If I wear my mask, I can contain it. So washing hands is really key. Sanitizing and washing your hands and doing it properly. But do we know how to do that? Can we do another activity, or are we? Can we do another activity on the washing of the hands? It is important to remember that you have to wash your hands and get in between the fingers, get over, remember the nails, the bed of the nails, and so on. So you apply the water, you apply the soap, and then you rub so that you make a lather, right? And then you go in between here. You don't have to do it in the same order.
Okay,
right? So you go above, right? You go in between again. And the next hand, you go like this. You clean your thumb. Yes.
Jessie, are you thinking?
She does have a PSA, by the way.
Yes. And you go above the wrist. Right, I saw Carlton doing the next step. You rub this up and down.
Was the one actually from Red Cross here. That was something really. And the intention is to do what when you
yes,
doing that?
To go under the fingernails and address the tip of the finger, because you're doing all that. You're not really addressing this part and under. So you try to get the soap to go in under the nails and so on. And sometimes you might just even have to clean it a little bit. Yeah. And then you rinse. Okay, and you use a piece of tissue to close the tap and so on. I prefer if we can conserve water, because obviously we're going through a crisis. Right. So you would gauge that. We do have a PSA out. So let's see if we can do that. I will guide you all.
Okay.
So you won't look like you're making any mistakes. So let's rub. We have the soap and water on our hands. Let's rub it together. We're making a lather. Let's go in between.
Pay attention, kids.
Like this. Right? Wonderful. Above the hand, rub it, and then go in between. Next one. Next one. In between. Thumbs. Next thumb. Okay, don't forget to go above the wrist. I should have done that one before. And then this motion here like this to clasp together, right? And then the fingers. So you make a circular motion, whatever kind of motion, and you do it for the other side.
Pay attention, kids.
And then rinse. The kids actually know that better than us. Yep. They're literally telling their parents, "Mommy, you're supposed to wash your hands." They know. They know a lot about those things. So I also want to say that you should sanitize your hands the same way. And you should, by the time you finish sanitize your hands that way, it would have dried up and you'd be ready to start touching surfaces. And we do this every time. I just want to remind persons that you aim for 100%. Nobody's perfect. So that for the most part, you would be covered. So you try to do it as every time so that if you fall short, you're still covered. Yeah.
And just one more thing before Jessie could move on with you. Why are we doing this? Pour qui ça nous a fait ça? Là, on dit laver la main, et presque 10 minutes qu'à laver la main, à l'enfant doit tout, commencer puis savon, faire si oui, faire un chim, à l'enfant, yon la mais point gauche la fait l'autre là, den point bout zong ou bout doit tout, fauteuil gon, fauteuil en mitan. Qui ça nous a fait là nous fait ça? C'est pour qui ça? C'est parce qu'il a nous sale, qui attention, là, dit moi, point presque 10 minutes de temps qu'à laver la main avec savon fait assis oui fait chim et puis pour qui ça qui a fait Lena fait ça parce c'est pas sale là mais moi sale moi j'ai entoué et moi toucher la porte là moi j'ai à l'en supermarket là yo ban moi sanitizer so le moi vais kay moi encore dit moi vie fait ça qui a fait là fait ça pour qui raison
même si l'homme pas qu'à garder sale ou qu'à sanitize whatever ou still expose all right expose bacteria vermin dust different bagay ou qu'à toucher ou still expose et so savon ni comment on peut dire pour tirer ces virus like right il ka pas just tray il ka
Détruit.
Tiwe a sous la main, nous ni pour really save différence là from disinfect ça va au café. It can kimanyo can repel it literally pushes the thing away from your hands. It pushes them away from your hands. It literally takes them away. Yeah, just ikatiwe. Mais là où sanitize, ipakatiwe a sous la main, it can just tray a pillow. Pas tout, a pile. Mais là où laver la main, ikatiwe a sous la main.
Quoi, ça on dit là où sanitize la main. Ça qui a fait là, il a tué un chat ici. Vers maintenant sous la main on ramé un bagage parce qu'un chat moun ka aller en boutique, ka aller différents côtés ça qui fait là, yo ka met bagage, yo ka met la porte. Jessie passe dans la porte là, Mazen Gozi passe dans la porte là, Cox passe dans la porte là. Moi mais tout le monde mais quoi ça on dit c'est ex savon avec chimnek manière 20 minutes là, c'est pour faire assis ou tuer. Ou laver sorti nettement la main.
Mais là où sanitize, il est là.
Il là, où tu en
chai. Mais là où laver, il a tiré sous la main, il a allé, il a sorti. À cause du savon, il a repellé pour tirer sous la main. C'est pour ça nous ni pour regarder sous laver la main et sanitize. Puis même si nous ne pas toucher tout visage, nous pouvons toujours un moment. Nous avons sorti un bagay, so nous pouvons toujours laver la main nous et try best nous. As I've been saying, Jessie and Carlton, I really believe self-awareness is key and developing a habit. So now that we've practiced the hand washing, you know you are aware, so now you can try to practice it and see where you can improve it. You understand what I'm saying? I recently spoke to a guy and while he was speaking to me, he coughed, but he just coughed. Well, I say recently. He coughed, and I could see that he has not been practicing. You understand what I'm saying? So if you have the habit, because when we were younger, they told us, do not cough out, cover your cough. We use our hands. So you already have that habit. So what you need to start doing is, even if you're not coughing, is to just practice, like literally, it might sound weird, but you literally have to, on your own, just try it. So that when the cough already coming out, your body has an idea, the natural reaction. We know also persons had been taught to cough like that. You can do it, but it's preferable if you aim for your elbow. So you practice. You practice covering your cough with your inner elbow, with a tissue. Sometimes you cannot always reach for the tissue. So you have to practice it so it becomes a part of you. And this is the key. That's why a lot of us are constantly falling short. It's not that we're not aware, we just haven't had the practice. So I just want to encourage persons, as we said, you need to cover your cough and your sneeze with your tissue or inner elbow. Avoid touching your eyes, your nose, and your mouth, because this is the way the virus can enter the body. Keep a safe distance. But what does 6 feet look like, Jessie and Carlton? What does it really look like? What can we compare it to?
I would say maybe 2 arms length.
Maybe 2 arms length. Okay, sounds reasonable.
The meter stick, you have the meter stick.
Right. If you think of the height of a door or the length of a door, that is about 6 feet. A table that holds about 6 people, that is about 6 feet. A normal size, the length of a normal size bed, like a double bed, right? That is about 6 feet. So for somebody to gauge what is 6 feet distance, maybe you're outside doing your gardening and your neighbor pass and they stop to tell you something. I mean, you're not running to go and put on your mask, you're at home, whatever, your neighbor is passing. How would you know that you are at 6 distance away from the person? You understand?
Right.
You can gauge it in that moment.
Yes.
You know, and you can have a short chat with this person and they go on their way. So we need to know how to gauge it and think about these different things that I just said there, the door, the table that holds about 6 people, and so on, the bed. You understand what I'm saying? There's also the arm's length. If you put 2 big dogs, one behind each other, that's 6 feet. So there are different things we need to become aware of so that we can, because in the community, that's where it can spread the fastest, because people are most comfortable with each other. So I mean, when you're home, you feel comfortable, obviously, you're going to be chilling closely with your family. So people act the same way in the community.
Yes.
It's like the whole community is there, is living at home with them. And that's what we're trying to tell people, to avoid this close contact. And if you're going to be out, be aware of the distancing, because clearly we've been saying it over and
protocol,
over.
without cutting you short, the protocol, I guess that's one of the reasons why they ask persons to adhere. We were saying the national protocol is there, which speaks to the distance, and asking businesses to demark those places, so it makes it even easier.
And speaking of businesses, returning to work at this time, we still have the threat of COVID-19. I read an article, returning to work post-COVID. Is there such a thing, post-COVID? You know, we still are dealing with this threat. If you could speak to our people will be returning to work after weeks of staying home. You know, from April 1st, there was the whole 24-hour lockdown, so we've sort of gotten psyched into that. Can you speak to when we're reopening, with this scheduled reopening, there may be a mix of emotions, so if you could speak briefly to the psychological aspect, as well as the reinforcement of persons taking on those measures that you just spoke of.
Wow, it's going to be a variety of different reactions. Some people might be extremely excited. A lot will be filled with trepidation and feelings of fear. Some will feel, okay, this thing is over, yay. So you have a so it's going to be a mix of things. I think everybody is different. And whatever somebody is going through at that moment, whether it be the fear or the excitement or the laid-back feeling, we need to engage persons. They need to have a talk with their boss. They need to speak, listen to us here. They need to get correct information so that they can move forward and just be assured that life has to go on, and all they can possibly do at this moment is to practice and continue to practice what we've been telling them to do, and to do their best within their scope, because there needs to be a balance. We have to be able to move forward, but we also need to understand that the situation is there is still a threat. So we need to, as I said, it's like a new normal in a sense, and if persons are feeling that trepidation and fear, we do have the psychological hotline that they can call. We have the 311 that if they've forgotten the number that they can call. It's a tough thing for some. It's another thing for other people who are taking it lightly. So it depends on where the person is at. When somebody has been locked down for so long, sometimes it can feel very uncomfortable. There are some people, they haven't really been out. Some of us have been in and out. So the fear and the panic may come up. Wow, it can be a difficult thing, but we've done it. We're always going through difficult times, and we have been able to step over the road. Just make sure you go with enough knowledge, enough practice, and enough precaution, because you don't want to step out there in fear and feel hopeless at the same time, doing the wrong things. If you do the right things, then you can reassure yourself. You understand what I'm saying? That I'm doing my best and I'm doing what I have to take, and I'm not going to listen to anything that is going to upset me. I'm going to try and stick to action. What do I do to prevent, rather than what everything that might go wrong? What can I do to prevent, and try to encourage myself? I also, apart from the covering the cough and wearing of the mask in public places, remaining at a 6-feet distance, washing your hands and sanitizing is key. I want to remind persons, because COVID-19 threw all of us off our diets. You know, whatever diet we were on, as a lot of us being home, we've been eating and eating. Some of us may not even be able to eat because we don't have the resources, we don't have the money.
So both ways. It
goes both ways. And one of the key things that we sometimes forget in terms of protection from COVID-19, I'm not saying in a sense that it means you won't get it at all. but is the way we eat, healthy eating, and we could probably look into that a little more.
Okay, wonderful. And speaking of returning to work at this time, St. Lucia is phasing itself, getting back into the groove of reopening its economy. And we have coming to sit with us in just a moment, Miss Peggy-Ann Soudatt. She is the Permanent Secretary in the Department of the Public Service. And we just hope that in addition to the protocols that are implemented by your bosses, by your employers, we do hope that you take your own initiative when you return to your work. Return to your desk, Naomie. Don't let people come and touch your desk. Don't go touching other people's desks or their stationery. If you're dealing with money, ensure that you have sanitizer. Ask your boss to make sure there's sanitizer.
Right.
So, yeah.
Yeah, so these are the key things. So I'm happy that you brought that up. There are a number of things that need to be put in place at the workplace, and you need to stand your ground with regards to the sanitization, ensuring that you have stuff to sanitize your office and doing it upon arrival, and maintaining all the protocols that I said, going on the website to determine what the protocols are for your business, so that it's not just your boss who knows, but you know, so that you can take a stand.
Wonderful. Thank you very much for your time. It was lovely once again with having Miss Naomie Grandison, Family Life Educator from the Bureau of Health Education, sitting with us. The time has run out. We could sit all morning with you. But we have our next interview for the morning. We hope you do stay tuned. Thanks once again, Naomie. Do stay tuned. We have the Public Service Permanent Secretary coming up in just a moment as St. Lucia returns to work. Stay tuned.
And in the latest news, the coronavirus, or COVID-19, continues to be a health emergency across the world. Caribbean people are concerned.
Everybody know about COVID-19. COVID-19. Keep socially distance and your proper hygiene. Wash your hands then clean. Don't discriminate, cause it might be. It very well could be. Somebody will look like you or look like me. Listening, listening. We're in this together. We all got to work with each other. Look out for our friends and our neighbor. And if you feel sick, don't be afraid to call the doctor.
Red Cross volunteers from across the Caribbean, working hard to fight discrimination. So if a person should feel ill, then they will contact the authorities without hesitation.
The most vulnerable are the elderly, but the truth is it can infect anybody. So what we need is solidarity. Everyone helping everyone like a family. So
this is a message to the nation. Make sure you seek out the right information from official sources like the Ministry of Health, Red Cross and the World Health Organization.
Everybody know about COVID-19. COVID-19. Keep socially distance and your proper hygiene. Wash your hands then clean. Don't discriminate, cause it might be. It very well could be. Somebody will look like you or look like me. Listening, listening.
People around the world facing this pandemic. Coronavirus have the whole world a panic. Now is not the time to be fearful, but to be careful, supportive and empathetic.
This is the state of the society. Some people full of fear and anxiety. Yo, a lot of fake news in the community. But what we need now is more love and unity. So
this is a message to the nation. Make sure you seek out the right information from official sources like the Ministry of Health, Red Cross and the World Health Organization.
Everybody know about COVID-19. COVID-19. Keep socially distance and your proper hygiene. Wash your hands then clean. Don't discriminate, cause it might be. It very well could be. Somebody will look like you or look like me. Listening, listening. We're in this together. We all got to work with each other. Look out for our friends and our neighbor. And if you feel sick, don't be afraid to call the doctor.
Cette lisi ka registre vers min corona ek i ka fait mouvement ek en chay vitesse tan chaque canef ka kouye pour vigilance publique là fait wolo parler en place publique qu'on bol en main base ti boutique changer distance sociale 6 pieds Hot yon a lot, i ka travay tan, Si ou senti ko pa cordial, quarantine ko. Pas twe en contact epi lot, en ka ou te twape expose. Si an ekouye, Free 11 ou ben n'importe clinique yo pou yo. Les pays a dimi à clé, ça veut dire les supermarkets, pharmacies et puis ATM, yo accessible avant c'était souhait. Pays à clé en plein, ça veut dire tout bagay fermé à 24 heures. Servi protocole comme sorti par bureau indication santé. Nous tout ensemble, ça sauve vermine corona. Si nous tous servi Jidla à toutes les.
Together let us win this war. Say Lucia be a soldier. Together we can beat this corona.
COVID-19 is a new pandemic disease as declared by the World Health Organization. It is transmitted directly by respiratory droplets when an infected person coughs or sneezes, or indirectly through rubbing the face with contaminated hands. There is still no specific treatment or vaccine against COVID-19, and as such, the farming community should adhere to some special recommendations. Ensure that farm clothing and gear is clean. Wash hands thoroughly before harvesting crops. Use face masks and head ties whilst harvesting, cleaning, and packaging crops. Use all safety precautions when transporting crops to the markets and depots, such as handling crates and crops with only clean hands and covering sneezes and coughs with a tissue or the inner arm to ensure body fluids or droplets don't get on produce, and washing hands or using hand sanitizer after using the tissue. More than ever before, your important role as gatekeepers of St. Lucia's nutritional, health and food security should be taken seriously. When you exercise these precautions, you not only safeguard your health, but also continue to allow all St. Lucians access to freshly grown fruits, vegetables and other local crops. Remember, it is our responsibility to ensure our nation eats fresh, St. Lucia's best.
Welcome back to the program. If you were just joining us, a special good morning to you. It's another day, another installment of St. Lucia's COVID-19 response report. This morning we were speaking to Ms. Naomie Grandison. She is the family life educator at the Bureau of Health Education, Carlton, speaking to us on, as we're returning to work, St. Lucia returns to work, the economy is resuming, and we hope that at this time you continue to observe all of the measures that we have been pounding in your heads. Wearing the mask, the 6-foot distance. If ever it was important, it is now that we're, especially as we're reopening our borders, we hope everyone will observe these, as well as, the psychological effects, persons returning to work, not sure, getting their footing, under this new dispensation. We do hope that you continue to practice the measures. We do hope that you can get back into the groove of things, a new normal of sorts. At this time, we do hope that you can do so as soon as possible, because the world continues to turn. And speaking of such, we have the Public Service Permanent Secretary in studio with us, Miss Peggy-Ann Soudatt. A pleasant morning to you, Miss Soudatt.
Good morning.
How are you?
I'm good, I'm good.
How's the public service work coming along?
Well, we are gradually opening up, and this morning, before I even start, I would like to thank all public officers for what they continue to do.
Absolutely.
From day one, some of them have been working, whether from home or in offices, and we must thank them. I know time and time again we have thanked frontliners. We cannot stop thanking them. We also have people who are, because of the work they do, they actually supporting the frontliners. And we need to extend special thanks to these individuals too. A very special group of people who continue to work to ensure that the country keeps running are the people from the Department of Finance. the Inland Revenue Department, the Customs and Excise Department, the Accountant General's departments, and so on. So they're providing, the support that is required to ensure that things continue to go on. And most ministries continue to operate. So we really need to thank everybody. Because I really don't want anybody to say, well, you thanked finance, and you thanked, but people have been working, and we know they have been doing their best. They have been putting right, and things are work, is operating. The announcement for the full operation of the public service, to take effect on the May 18th, was made, and so we had to put things in place to begin operation almost immediately. What we did as the public service was to put protocols in place, establish some protocols which we shared with all agencies of government to ensure that they understood at least the minimum, what was required at minimum for the reopening. But before I go on, I just want to indicate what the full operation means, and it is indicated in the SI number 74. The full operation means operating a service in accordance with physical distancing protocols and in the normal location and within the customary time. And so understanding that, we also had to, and it's actually stated there, that this has to be done in accordance with physical distancing protocols. So as a public service, what does that mean for us? We encouraged people, agencies, to identify what can be done. So the first thing you had to do was to determine your numbers. If you are going to do physical distances, how many people can you comfortably or safely bring back into the workplace?
Within the square footage.
Within the square footage and so on. And the proposed distance is, I think, is at least 30 feet, So we had to take we have to take it into consideration. One agency said to me, because of the layout, they were able to bring in everybody. It's a small ministry, and because of the layout, everybody maybe has an office or cubicle, but the layout allows them to observe the physical distancing protocol. So that was good, but not every agency is fortunate. So having determined the numbers, we now these agencies need to determine how people will work. So will it be a case that other persons would need to work from home, rotation, a shift, and so on? So the agencies would need to determine that, look at your layout, look at your space, the available space, observe the physical distancing protocols, and then make the decision who is going to work from home, how people are going to work. And when this is done, what we had done previously was to develop the alternative work arrangements policy. So this would kick in at that point. So this is more or less what we have encouraged them to do. And additionally, there are some hygiene issues that they need to be observed by agencies. So within our document, we spoke of the responsibility of managers. We spoke of hygiene, general hygiene practices. We spoke of personal protection of staff, and we also spoke about the responsibility of staff. Because at the end of the day, we must all take individual responsibility for what is happening if we are expecting things to get any better. So this is more or less what we covered in the protocols we have developed for the public service.
Okay, we're speaking to Ms. Peggy-Ann Soudatt, the Permanent Secretary from the Department of the Public Service, just speaking on preparations for, what we have seen as the resumption of full operations in St. Lucia. St. Lucia is returning to work, and the public service a very critical component of our economy at this time. Do stay tuned. We will continue our discussion with Ms. Soudatt in just a moment.
In an effort to ensure patient and first responder safety, the St. Lucia Fire Service has reviewed its patient transfer procedures, especially for patients with respiratory distress. Face masks will be provided. At no time during transportation should the face mask be removed. Please be patient and cooperative during this time to ensure you receive the best possible care while keeping our first responders safe. With all that's happening around us, simple adjustments are necessary to keep us all safe. When calling 911, we may need a little more information to deploy the right personnel and protocols. You may be asked about your travel history, signs and symptoms, contact and movement history, and whether others in your household are exhibiting similar symptoms. Please be patient and cooperative during this time to ensure you receive the best possible care while keeping our first responders safe.
Coronavirus? I am worried, Gassa. It's only old people dying from that.
Hold up. Being young does not mean being safe. Yes, it's true that the elderly are at higher risk, but anyone can get the virus. The effect is even worse if you have a chronic condition like hypertension, heart disease, lung disease, and diabetes, or weakness in your immune system. If you are living with these conditions, be extra careful. Wash your hands with soap and water. Use hand sanitizer with at least 60% alcohol when hand washing is not possible. Avoid touching your face. Take steps to boost your immunity through proper nutrition, exercise, rest, and take your medication as prescribed. Limit being around people who have flu symptoms, even close family members.
Our health is in our hands. Together, through simple actions, we can stop the spread of coronavirus. This message was brought to you by the Bureau of Health Education of the Ministry of Health and Wellness.
Can I bring that up?
Yeah.
Okay. Thank you for staying tuned. We are in studio with the Permanent Secretary in the Department of the Public Service, Ms. Peggy-Ann Soudatt. And just before we went to break, she touched on roughly about the personal responsibility of employees and as well as the management within the public service. And I want to start with the management. We've seen the list of protocols that have been released by the Ministry of Health and Wellness. Of course, the public service would have had to recognize more than one because of the wide-ranging services that you provide. Can you speak to the responsibility of management and how this will pan out within the public service?
Okay. Well, you mentioned the protocols established by the Ministry of Finance, and I would like to say at this point, and I would also like to thank the CMO and his staff for reviewing the protocols that we developed before we sent out to the agencies. So, well, managers have overall responsibility for ensuring the proper implementation of the protocols. We also want to inform that what we are going through there is not only necessarily would not necessarily only have a physical impact on people, but a mental issue too. So as managers in the public service, we need to be very vigilant and understand what is going on. We need to ensure that the protocols are implemented properly. It should not be, when we remember and so on. There needs to be a level of consistency in establishing the protocols. One of the things we've spoken about in the document is to ensure that we avoid congregating as much as possible. So managers have to ensure that things like meetings are properly organized. You must have about at least 30 square feet per person. But as much as possible, we want to encourage virtual meetings, unless it's absolutely necessary that you bring a group together, but then you must observe the 30 square feet policy or recommendations by the Ministry of Health, Department of Health. We want managers to ensure that there's proper signage. People understand what is expected of them in the kitchen. At lunchtime, that is where we meet our friends and we socialize a bit, and so on. So it is very important that managers are made to, communicate with staff to help them understand what is being put in place and why it is being put in place, okay? If people understand why, they're better able to respond. So the communication is very important, and managers must understand that now is the time to communicate. What is happening? Why is it happening? Your performance targets may change a little. Your performance assessments or the timing of your performance assessments may be different. So probably if you had that conversation every month, you may need to have that conversation weekly now with them to ensure that people are doing what they understand what they're doing and they are delivering. Because a lot of things are going on right now in people's minds, and maybe somebody who performed excellently before, you are seeing maybe a drop in performance and so on. So the communication is very important at this time. People are homeschooling, and they would need, they may need to separate, one from the other, because, so do we change the time, people's work time? Do we expect them to work the whole day and so on? But communication is very important at this time.
Okay. And speaking of communication, hopefully that is done very effectively. So now we're moving into the response of the employees. Can you speak to their responsibilities going forward?
Okay, I just, the employees, management is going to put certain measures in place, and it is important that we understand what these measures are. And adhering to the measures are important. So if you are asked to wear a mask, well, not if you are asked to wear a mask.
It's mandatory.
It's mandatory that you wear a mask. You should ensure that you do it. You need to take some personal responsibility for this thing. You need to take personal responsibility for your space. So although we may have upscaled cleaning, doing regular cleaning, somebody may not be able to come to you, or maybe even bother you for a cleaner to come to you every 10 minutes wiping down your desk. So these are little things you could do.
It doesn't absolve you of your own cleaning.
Exactly, yes. These are things that you could do to protect yourself, to protect your family at the end of the day, So if you need to sanitize your personal workspace, the employer would need to provide the supplies and so on. If you're asked to wear a mask, if you're told that you cannot enter the building without wearing a mask, then you need to adhere to that. It does not, because you're an employee of working in a particular building, it does not exempt you from not wearing a mask. It's not only the public, but you would need to do it. What we have, as a matter of fact, indicated that in the document is that we need to give at least one cloth mask, and I'm saying at least one cloth mask
to every
staff member, because we have a responsibility to ensure the safety of staff. We ask people to wash their hands regularly. One of the things we know it's uncomfortable. The mask is uncomfortable, and people may not be able to keep it on the whole day. I really cannot keep it on the whole day. But when you are walking, so you leave your desk or your office, when you're confined to your office, you take off your mask, you can, But when you are going into the general areas of the office, you should put your mask on before, you enter. And it is not only for us, but it is for the other people we interact with. They feel a sense of safety when they see you with the mask, because people might, if they don't see you with a mask, they might, and so on. So these are the little things that we ask in the employees to do. Just observe these basic practices, basic health practices.
Absolutely. In addition, a section of the public service handles money. It's talking about places like the registry, they take fees and so on. Can you speak to the measures that will be put in place for people, staff accepting monies from the public?
Yes, well, they have, most of them, well, to a certain extent, even through the shutdown, or should I say the scale down, they had been working and handling monies and so on. So the measures, the basic hygiene practices would be necessary. So the constant sanitization, the wiping down of the counters, and things like that. Depends. Agencies now, what we're prepared with the basic protocols. Agencies now need to look at their particular, or permanent secretaries, managers need to look at their particular agencies and determine if it is necessary to heighten, the PPE, So if they require gloves, then they should be able to give them gloves. If they require face shields, because that is one of the things in the document, you should heighten where it is necessary, the level of PPE that is given to staff.
Absolutely. And there is a component to, public service offering that is physical, and some staff must come to work. You've seen we were speaking the last interview about the way in which working from home, you saw increased productivity in some areas. Can you speak to whether or not the public service right now, the extent of its consideration of persons working from home? We're seeing some parents will have to perhaps stay home. They have nowhere to put their kids. That taken into consideration. What plans are in the pipelines for that?
Okay, I want to say that in considering who works from home, there are a number of considerations. In most cases, we have been saying, look, vulnerable people may need to remain home. But how do we approach that? Anybody could say, I'm vulnerable. So what we are encouraging people to do is to bring in your medicals
to show
that you are vulnerable.
Okay.
We have the issue of people working from home now. It is something that needs to be managed, but people who want to dedicate their time fully to that, we now at full-scale operation, back to full-scale operation, so people can apply for leave to deal with these issues because we're back at full-scale operation. And I want to say, working from home, it's not a vacation, it's not time out. If you're expected to work from home, you work from home. Your hours will be determined by your supervisors, your managers. You are expected to be available during the day for work. And if you cannot do it, if you cannot give that time, then you may need to apply for your vacation, so I just wanted to speak to that. In terms of the level of productivity, that requires a level of monitoring by managers and supervisors. There are some people who could work very well from home, but there are some people who cannot. And sometimes it's just a case where they don't have the proper environment.
Yes.
In other cases, they probably would work better knowing that there's a supervisor who could, some people work better that way. The supervisor is there looking over you. Some people prefer that level of,
structure.
Yeah, structure. And some people could work very well without it. So when we decide who works from home, we also have to look at the individual and how they work. And that is very important.
Okay. Carlton?
Yes. Thanks so much. Merci pour qui a écouté nous bon matin sur jeudi. Vous savez qu'on la coutume nous avoir développement information. Bon matin pas pièce différence et puis nous studio nous à ce programme nous va parler by mademoiselle Peggy-Ann Soudatt. C'est lui qui permanent secrétaire là venu pour département service public. Écoute un annoncement fait là ni pour faire et puis mon ka vie en travail avec business ka ouvert. Parmi ces business ça vous savez c'est gouvernement. En chaque département gouvernement te ka opéré mais à présent nous ni plus mon ka vie en travail. Là il vini pour côté yoyé c'est département qui manière bagay ka marcher. Il y en a ces bagay là nous attend hod Soudatt qui premier pas, il remercie tous ces travailleurs parce qu'il dit parmi tout ça qui est allé à la c'est un bagage qui bien c'est un bagage qui a dit qui bon tout bonnement pour manier mon adopter travail la manière moun fait travail en bas toute situation Covid là quand yo te ka délivrer moun produit travail quand il a dit merci il dit merci expressement encore pour ces gens essentiels là qui te ka toujours fait travail yo et quand oui il pas manquer personne il dit tout le monde expressement là il vient à bas département service public là il ka oui merci yo pour travail yo quand en détail là il vient pour qui manière bagay kaye qui manière business kay trouver quoi conducteur en parmi bagay ja adressé il dit là il vient pour qui ça qui mettait en place en différents environnement ou savent bagay différent là il vient pour distance sociale là en compagnie moun ni place qui plus go quoi yo même ça fait avec agir puis on a l'autre en compagnie petit quoi ça il a dit là hani yon protocole national tout le monde connaît distance sociale là laver la main faire assis ou ni masque c'est bagay ça généralement tout le monde connaît li mais ça il a dit à présent c'est différents monde qui responsable pour département yo kay ni pour venir à présent c'est manager yo kay ni pour venir à présent yo kay établi yon qui kay travail ba yo premier pas en parmi l'autre bagay veut travailler qui vulnérable en parmi ou et ça monsieur Mazer Soudatt ka dit c'est là vini pour situation n'importe monde ça vini dit moi vulnérable moi malade il dit ou kay ni pour produire document pour montrer ça hot docteur quoi laisse ça yo kay savent l'autre bagay là yo kay ni pour prendre en considération à part des monde qui vulnérable parmi ces travailleurs monde qui ça travaille la caillou mais en même voie il a dit sous ka travaille la caillou ou supposé produire ça pas veut dire on en vacances ça pas veut dire c'est un holiday non il a dit ou kay toube ko ou kay ni supervisor ou ka veo ou ni pour produire travail même manière ka travail pour 8 heures de temps 5 heures de temps ou kay ni pour produire travail il dit là dans compagnie monde qui pas ça faire ça ou pas ça faire ça ou peut-être ça prend livre et ben ou kay ni pour venir dans manière pour yo rectifier situation mais ça il a dit en tout business kay vie là il vient pour service public là yo pawe là il vient pour travailler yo ka expecter ou kon yon monde qui ka travailler n'importe département c'est pas toutes les là ou pas dit ton ka travailler yon monde qui vient nettoyer kon du vote quoi yo ka expecter monde prend responsabilité chaque monde sous 80 département masse là il a dit ou pas obligé nan masse toute là ou acide là ni monde qui passe après l'expiration et puis masse là ni monde qui pas confortable et puis et qui a dit si ou là pas correct ou border sous ou en office il bien bon pour pas ou s'attirer masse là mais ça il a dit aussi sous ka sorti ou ka venir peut-être côté monde ka manger c'est pour mes masse et changer ou ka protecter corps et ou ka protecter travailler moun qui bon en parmi l'autre bagaille qui bien important mentionner là vini pour manager à présent kay ni antitak plier sous la main yo en parmi bagaille fait moun plus confortable bay moun explanation yo kay aussi ni pour mettre signe pour dire moun ça pour faire ou ça ouais yo kay ni pour mettre sous la porte yo kay ni pour mettre avant moun entrer pour dire ça yo expecter pour faire là vini pour protocole fait yo changer qui ça yo ni pour faire là il vini pour ça quoi là bien observer ça qui a aller changer encore là il vini pour service public là Mazer Soudatt a dit yo te là ka travail toujours travail pas jamais de bout mais à présent quand tout le monde a retourné chaque département kay considérer ça qui ni pour mettre en place et yo kay établi et yo kay ni responsabilité pour faire assurer moun suivre JID quoi c'est ça nous ka parler dit et ça c'est information bon matin nous ka bien quoi ou ka comprendre nous ka suivre ça ka là parce que qu'on nous bien dit qu'on ça ka développer qu'on pays a ouvert nous ka une plus information que moun ka expecter les yo entrer en ces business ces place business ça qui ça ou kay joindre là. Jesse?
Thanks for that. When we come back, we're due for a break. When we come back, I want to touch on with Ms. Soudatt emotional stress and well-being on the job. You spoke about some performance inhibitors, so perhaps we could go into that a little bit. But before we go to break, I just want to ask, will some offices of the public service need to remain closed based on what the observations of your office at this time in terms of the physical distancing? Will we see offices having to be closed?
I think there will be a level of presence in most offices. Okay. I think most offices will be able to accommodate a level of presence. There will be people who would need to be on rotation. I mean, I was having a conversation yesterday and I was told that people are asking, public officers are asking, well, you know, why am I at work when other people are on rotation. But we need to understand that every situation is different. People need to assess, like we said, the physical space, the layout, and see who can come in. So not everybody in every agency may be able to come in. So they would need to continue operating in that way, rotation, shift, and whatnot. So, and public officers must not understand, it's not a game, it is not a privilege, a benefit, so they must understand what we are trying to do. So, if you have to be at work, if the place is deemed safe enough for you to be at work, you should be at work. But there might be somebody else, maybe in another division of the same ministry or another ministry or department altogether, who may be working on a rotation basis. But again, this would be done based on the assessment and the decision of management. So it's not a case, it's because, Jesse is on rotation, then Carlton has to be on rotation too. Every situation is different.
Okay, do stay tuned. When we come back, we speak on emotional stress and well-being on the job. Obvious performance inhibitors may play a role as we return to the new normal. And also we speak about the role of patrons in terms of accessing the public service agencies. Do stay tuned for that and more coming up in just a moment.
Cette lisi ka registre ve min corona ek I ka fe mouvement ek an chay vites tan chaque canef ka kouye pour vigilance publique la fe wolo parler en place publique kon bolan me base ti boutique changer distance sociale 6 pieds Hot yon a lot, I ka travay tan, si ou santi ko pa cordial, quarantine ko, patwe contact epi lot, an ka ou te toape expose. Si yon ekouye, free 11 obe nepot klinik yo pou yo. Le peyi a dimi akle, sa vle di, le supermarket, pharmacie, epi ATM, yo aksesab avan se tet swe. Pays à clé en plein, ça veut dire tout bagay fermé à 24 heures. Servi protocole comme sorti par bureau indication santé. Nous tout ensemble, ça sauve vermine corona. Si nous tous servi Jidla à toutes les.
Together let us win this war. Say we shall be a soldier. Together we can beat this corona.
It's easy to become afraid during a disease outbreak, especially a pandemic. How can I catch it? Who already has it? How do I stay safe? How can I keep my family safe? Uncertainty can lead us to reject or to be afraid of people affected by COVID-19. It's normal that we feel worried. But sticking with the facts on how to prevent COVID-19 from spreading and what to do if you encounter symptoms is our best defense. Rejecting or fearing people can cause them to hide their symptoms. It discourages people from practicing preventive behaviors like wearing masks and physical distancing. It can even stop people from seeking health care. Ultimately, this means the disease is harder to diagnose, treat, and contain. So how can we overcome fear and stigma to help the fight against COVID-19? Words matter. Talk to and about people affected by the virus with respect. Spread the facts. Practice and share the recommendations endorsed by your health authorities. Be kind and look after each other. Check in on your family, friends, and neighbors. Offer support where you can. Have you seen social stigma happening in your community? How did you respond? Tell us in the comments below.
Thank you so much for staying tuned. We are speaking to Miss Peggy-Ann Soudatt. She's the permanent secretary in the Public Service Department. St. Lucia gets ready, in some cases has returned to work, and the public service effective May 18th has resumed its full offering, its full suite of services in St. Lucia. We're now at the point where I want to talk about emotional stress and well-being. A lot of persons, you mentioned performance inhibitors earlier, persons may not perform as well on the job, perhaps they're thinking of, COVID-19, stressful situations, Can you just speak to this aspect of returning to work and any advice that you could give your public servants at this time, especially as both employers and co-workers, should watch for signs of emotional impact, the early signs of it, and ways that they could cope at this time? If there are any ways that, any services that you're offering?
Right. Okay, so we know that people are still trying to understand what is happening with COVID. Every day you read something, you listen to the news, you hear some other thing happening, different mutations, more children being affected and so on. So people are genuinely scared, and these things, even the new work arrangements that they are not used to, that might cause some level of anxiety. People are concerned about their children who are at home. And all of these things would probably impact the emotions and the mental well-being of people. And so we encourage managers to talk to people to find out what is happening with them. We encourage staff to talk, to say what is happening. We don't, just sit. If you have what COVID is calling on us to do is to build a lot of trust. We need to build a level of trust. We need to talk to people more. And within the public service, we have the Employee Assistance Program. The services are still available. We encourage people who, to use the services of the EAP. The information is still the same. They call the ministry, set an appointment, and so on. The most important thing is talking and having somebody you could trust to talk to. That relieves a lot. Even within the public service, when we do our check-in meetings with managers, we start our meetings most times by asking the managers how they feel about what is going on. You encourage them to meet with their staff prior to that meeting to find out how the staff are feeling, how they are coping at home and so on. That was during the shutdown and so on. So it is something we do because we understand that this thing is impacting people's not physical health and so on. And there are people who genuinely don't like to talk about their feelings. There are some who feel there's nobody to trust. And I think the EAP is a good opportunity, a good avenue for these individuals. So if you think you cannot trust your manager, but most times in our life, there's somebody we could trust, But if you feel, and some people may very well need professional assistance as opposed to just, that casual talking and so on. So we encourage them to take advantage of the EAP.
Okay. In addition to that, we're just looking at patrons, sort of shift gears a bit, to patrons coming in and making use of the services now. Can you speak to what will be expected of individuals coming into the public service spaces?
Yes, and that is taken care of in our document. There are some basic protocols. Again, the Ministry of Health keeps talking about it, keeps educating us on these things. So when people come in, they should expect that they would have to sanitize, their hands and so on. We would be putting up, in various forms, because we will be putting up, these diffusers, hand sanitizers, diffusers. At some agencies, you may very well have somebody with a spray bottle, spraying your hands with some sanitizer, or rubbing alcohol or something. People are expected to wear masks. People are expected to observe the social distancing, the physical distancing protocols. So we will be putting markers to ensure that people could estimate where they should stand, you know, as opposed to somebody else. We will be putting up signs informing them that things like physical distancing is in effect in the particular building and so on. We are working with the landlords who have responsibility in most cases for the common areas to ensure that they put up the signs and so on. For a number of agencies, they will be expected to put up the signs and so on. And it doesn't really have to be anything fancy, you know, because I went to the transport board recently and there was some tape and it looked presentable, you know. And the point is people were adhering to it. You walk into, we've seen a lot of what is expected of patrons happening in the supermarkets. Yes. We've kind of, you know, got that training from there. What is expected when you enter the supermarkets is not going to be any different to when you enter the agencies. And I just want to say that we may not get it right immediately, but we will continue to review, assess the situation, and see how we could improve. So, for example, one of the things we discussed was that it's working well in the Graham Louisine building now, the patrons coming in and so on, but traffic is still slow. When traffic heightens, we may need to adopt something else, you know, and so on. We see a number of people lining up outside buildings. The hurricane season, the rainy season is near. When it begins to rain, what do we do? How do we approach it and so on? So we recognize that we may not be able to get everything right the first time, but we need to continue to review, to monitor, and to implement the changes necessary.
And speaking of changes, you are increasing your cleaning suite. Tell us more about that.
Yes, so what we encourage agencies to do is to increase the training the cleaning in their agencies. So for example, normally cleaners would come in at the end of the workday to clean
in the public service.
In the public service, but now we recognize we may need to have we need to have somebody on daily to clean, especially the common areas. So staff would probably take responsibility for wiping down their desk and, you know, wiping down their phone and the tools they work with and so on. But in the common areas, like maybe the kitchens, the washrooms, the lobbies, the elevators, and so on, we need to have, you know, continuous cleaning going on in these areas. So we encourage people, if you may and you can, you know, if you bring it, these things are going to be at an extra cost, but we need to do what we must do to ensure the safety of all.
Absolutely. And we're rounding off. I just want to hand over to Carlton to just give us a summary of the last 10 or 15 minutes of discussion.
Merci tellement, Jessie. Merci pour vous écouter nous. Nous ici à Headquarters COVID-19, Kabao Information Développement, que ça nous ici et puis nous à Soudatt. C'est l'équipement sécuritaire est venu pour le département service public. Là, il a touché en chaque matière. Parmi eux, qu'on nous vit après pause là, il a parlé de qui ça ou ça expecté qu'on yon travaille Jessie Madé pour moun qui apprend ça qui a fait la peine pour moun dans yon manière ben l'autre la vie a trouvé quoi changer ben impacté dans yon manière ben l'autre qui ça qui là yon a ces bail là qui bien important moi quoi travailler qui en service là qui savent ça yo couiller IEP qui c'est un programme assistance by gens qui travaillent en service public là quand ça aller parler ben yon moun faire arrangement pour ouais moun qui qualifié moun peut parler ni confiance en ces moun ça parce que c'est moun ça c'est moun qui a tourné pour ça et puis ou ça une assistance ça au freeness et c'est yon ka dit point l'avantage de lui parce qu'en chaque moun pas aimer parler en chaque moun pas vle associer et ben dit parler affaires avec moun qui en même secteur puis quoi service ça là quoi il dit c'est yon qui a valide by moun qui travaille en service public là qui bien important. Parmi l'autre bagay vitement ou kon public là citoyen Saint-Lucie qui a servi service c'est public là entrer ça ou dans différents départements différents côtés Mazel Soudatt a dit protocole général là qu'on masse distance social la, ek ou kay we kote yo mette bay pou sanitize lanman, ou kay we sign gadou ko pou dou bout, ni à terre, ni à sous la porte là, yon nan se bagay lan ki bien important aussi, c'est avant, yo te espérer les business fermés pour moun et ben pour ces gens qui ka nettoyer, vini nettoyer place là après travail. Mais à présent ça y a dit en ces places là côté moun ka servi en chai, eleveta en ces cantines dans ces places là, côté moun ka monter descendre bien souvent et la kay ni moun pas du temps journée en ka aller ka nettoyer ces places ça. Quand il bien important il dit pour moun savent ou pas kay hen tout bagay en ordre là même. Mais yo ka travailler à souille yon an ces observations il fait c'est par exemple nous en saison hurricane qui ça qui a fait les moun asou en ligne parce que nous avons chay ligne dehors c'est building ça délai qui ça qui a fait les moun ni pour espérer dehors quoi il dit pas du temps bagay commencer à marcher pli pas du temps yo commencer à ver qui manière pour ajuster quoi yo ka ouais bagay ka marcher pli mais quand tout il y a des publics là c'est expecté pour protocole établi et pas du temps yo ka aller
Thanks for that. Any final words, Ms. Soudatt?
Yeah, I think I could close by indicating that our people are resilient, they're innovative, and they're strong. What we are forced to do now, what we are forced to do out of necessity today, will become the new normal. The remote working, even customer self-service. So Marlon last time spoke about the DigiGov project, and our social media engagement and so on. This may become the new normal. And I think after we have gotten out of this crisis, we will emerge with, well, there will be a lot of expectations of everybody, how we do work, and so on. It's very important that we take note of the lessons learned from this so that we could move forward and do it even better. So I want to end by just again thanking everybody. I think it is a time to build meaningful, trust-based relationships, and we need to help each other so we could weather the storm. Yes, that's it for me.
Thank you very much. Ms. Peggy-Ann Soudatt, the Permanent Secretary of the Department of the Public Service. As we reopen, we resume our economy, our social operations here in St. Lucia. The public service also, the agencies are up and running effective 18th May, and we do hope that you were listening and paying close attention. The employers, the managers in the public service, employees, what your role and responsibilities are, as well as patrons. We do hope that you have taken note of what we have outlined in this morning's interview. My name is Jessie Leonce, Carlton Cyril. On behalf of the production team, we'd like to thank you so much for staying tuned. Please remember, we are still under a state of emergency. We're opening up our country. We have to resume. The world continues to turn, but we do hope that you continue to observe the important measures at this time. For businesses reopening effective 18th May, take a look at the protocols that have been placed on the COVID-19 response.lc website to ensure that you are in adherence as you reopen your business this week. So we leave you with these admonitions, and we do hope to see you tomorrow morning bright and early as we continue with our COVID-19 response here in St. Lucia. Do enjoy the rest of your day and stay tuned for more NTN programming. Goodbye.
Coronavirus, but children